Hello there everyone, and welcome to another episode of Feel Good with me. I'm your host Dan, and today I have the very great pleasure of introducing to you Dr. John Butler. Dr. John Butler is a hypnotherapist first and foremost, but he's also got background education in medical and psychology and counseling, so he's done a lot of things. I've got to know him through a very good friend of mine, a dentist doctor, Dr. Nigel Agar, which we can interview, I hope, in a future episode as well. And he saw that I'm struggling with my chronic fatigue syndrome, ME and IBS for many years, and after trying so many different practices, he told me, please try a session with Dr. John Butler or go to do a couple of courses with him. I think it will help you a lot. You are into the psychology and the mind anyways, so I think you will get it. And it took me maybe a couple of years until I woke up to it, and because maybe I was a bit closed-minded. I have a degree in psychology, so when you hear hypnotherapy, you look down a bit about that, or you just think, well, there's not enough scientific evidence to support it, or at least that's what you are told. So yeah, it looks like something from the past. It's the first form of therapy, I believe. It's come from the sleep temples. Maybe Dr. Butler can cover that for us in a bit. So yeah, it just took me a bit, but then Dr. Agar told me, Idan, do the course. I'll pay you to do the course, please. And when someone pushes you so much to do something and believes in it, and he's such a positive and wonderful person himself, Dr. Agar, I said, let me do it. And I came very skeptical. I thought, it's not going to work for me, but give it a go. And I remember on the first day, Dr. Butler demonstrated a full body hypnosis, sending someone into try an instant induction, an instant trance. And he's a real master at this. There's probably no one more qualified than Dr. Butler in our generation to do what he does. It's embarrassing. It doesn't like people saying those things, but he's really at the top of his game. And I volunteered to do the full induction, and I remember he made me look into his eye. He's done his thing, and I collapsed to the floor. Like he spread me like vegan butter on the carpet, basically. It was incredible. And you're in between something. I'm not spiritual, for those who know me, and I'm an atheist, but the lights are out, and you're like in a dream state all of a sudden. And that was a very special moment. I felt real deep relaxation, like a very high meditative state, which it was unreal. And that happened instantly. And then later I done some sessions with him, and he taught me how to work on my IBS. And it's absolutely changed the way my digestion was. I used to have very bad acid reflux, and yes, food combining does help a lot. But with the method that Dr. Butler taught me, for example, before I eat a meal which doesn't combine well, he taught me to use my imagination and imagine me eating things which are bitter, because bitter herbs are very good for digestive juices, and so maybe chewing into a lemon or a lime or a ginger or a turmeric. And it just changed the game for me, that kind of method of I can eat anything basically now, and I won't have any issues. That's good. And from, as you know, going 20 to 25 times a day to the bathroom with the runs, it's also helped a lot relaxing that. Well, before it was added chili or garlic or onion or something, then now I can just imagine myself taking deep breath in, and it's all digesting, and it's taking its time, and there's nothing going crazy. And the difference it does, and with my fatigue, so he told me, if you have blood circulation issue, you should just imagine yourself doing some light cycling somewhere, or imagine yourself walking where you want to walk, and by the time you finish to do this visual hypnotic state, you can then walk yourself often to those places because you've done it in your mind. So both your confidence and your energy can rise. So for me, hypnotherapy has a very special place in my heart, and especially Dr. Ba. He's just he's done incredible work with that. But Dr. Ba, maybe you can introduce us a little bit to hypnotherapy, a little bit to your story, how you stumbled upon that, because it's quite unique as well. Not like your family taught you that. It's just something that you actually earned and discovered yourself. And then how hypnotherapy can be used in post-viral infections, in autoimmune conditions, in extreme fatigue and weakness situations, in IBS, maybe, and in aches like in fibromyalgia. Maybe you can tell us a little bit how this can be helped by hypnosis, because it's just not very known. It's a fascinating field. It's a very old field, but I just feel we're missing out. Like I was in my 30s when I found it, and I'm a person that research all the time things, and it's such a shame that I didn't know that just a little bit earlier. I could have avoided so much bad situation. But anyway, this is for me to you, John.
Okay, Idan, and thank you for those who are tuning in here to this. Well, you've asked about how I got involved. It's hard for me to pin down exactly when and where my interest developed from, but I would have said there were several things likely to be involved. One seems to be just a natural curiosity about the mind and its power. I've always had that. I've always been fascinated by the roots of human behavior, how people think one thing and then do something different to what they believe in, or at least say they believe in. And I was brought up with religious beliefs, and there were certainly negatives about it. There were a lot of good values and positives. One thing that about it, though, relates to what we're discussing now, was I saw people having a strong belief in healing, getting healed at times when there was very little real medicine available. They couldn't afford it, it would have been private, and frankly, it's such a long time ago now, there wasn't a range of medications like nowadays. So people didn't always get healed, but some did, and certainly enough did to keep that opinion going, that they believed in a certain saint or a certain healing shrine, or so on. So the power of the mind then, and this is not to, in case I'm offending anybody with spiritual beliefs, saying, oh, it's all placebo, it's all belief only in the mind. That's not what I'm saying. I'm saying, though, that people's attitudes were critical in being able to use these powers of mind, powers of nature, if you will, whatever. And of course, bringing that into the kind of modern secular era, we know the power of placebo is a very great power, and for years not recognized in medicine, at least mainstream research medicine, and then it has had to be accepted then that every trial has to have a placebo arm. And so we're seeing the power of the mind recognized more and more, Idan, in everyday life in medicine, coming into medical practice. Even in the medical journals, periodically it comes up. Should we use placebo? Overt placebo, telling people something that isn't real, allegedly, or at least giving them the opinion about this medicine different to what on the surface of things would be the case, to activate their own belief in the medication, to increase the value of placebo, and so on and on. It's a very complex area, by the way, and there are ethics and morals to it, and so on. But there are ways of using it, in my opinion, that are perfectly valid, and we would call those in hypnosis, hypnotherapy, we call that suggestion and waking hypnosis. To bypass the critical factor of the mind, which would normally say, well, it doesn't happen, it can't happen. And now, by bypassing that critical analytical part of the mind, to be able to accept a benevolent, a positive suggestion to enable things to progress. Because the critical factor, of course, through education and so on, it's not that it is simply just, absolutely scientifically accurate. It has its own biases and beliefs gleaned from whatever we've been trained to believe in. As many doctors are not trained to believe in the power of the mind. That has been changing the last 20, 30 years, but it's a slow process. So, going on then, how does this work within medicine and the kinds of conditions, some of which you were referring to, touching upon, like fatigue, irritable bowel. Well, there's many conditions where medicine doesn't have a ready-made answer. In fact, we don't even have a really accurate diagnosis as such. And problems come from there then. How do we understand the pathology to develop medications? IBS, to give an example, it's irritable bowel syndrome. So simply put, the bowel is irritated. And a syndrome means essentially a collection of symptoms that tend to go with this condition, but that they don't amount to a physical known pathology as an origin, that we have an origin for. So a disease state that we can say, yes, this is an organic disease condition. And then the other kind of problem we get a lot in medicine is a functional illness, which to our knowledge so far doesn't have a biologically determined cause. And so hypnotherapy could help people with their physical symptoms, even with an organic condition, help them manage the pain, help them boost their own healing, because one of the things we want to get across to the patient is we are self-healing organisms, and that process is largely controlled by what we call the subconscious mind, or subconscious part of the brain, if you wish. And that happens automatically. Our bodies heal, recover, and are regulated all the time. And every organ, every system in your body is under the direct and indirect influence of your subconscious parts of your brain. So it makes sense if we can stimulate that to benefit ourselves, to increase its levels of activity. And we do that through suggestion, imagination, and belief. We stimulate the subconscious mind, which is an emotional mind, a mind of imagination and creativity, and many, many levels to it. The other side of the coin is, of course, when we're anxious and worried and stressed, and we are fearing an illness, fearing a virus, an infection we've got. We give it more power over us. We're focusing on illness rather than on healing and recovery. And so we can harness the mind very positively in medicine. Now, if we look at something like IBS, where the gut is affected, we've all experienced stress affecting our gut as part of fight-flight mechanism. People just about to go into major examination, say in their their final year in university, and there's a lot hanging on the outcome of that exams. They may well be in and out of the toilet more frequently that morning with bladder or bowel. And so, and in a simple way with organ language, so-called organ language, when people talk about their problems, about how it affects their bodies, they might say, well, he makes me sick. You know, that's sickening, what that man has just said. Or, he's a pain in the you-know-where. He's a pain in the rear end, right? And I'm sure you can think of many others applied to the gut. But that's just with the gut. We often say he's a pain in the neck, or he gets under my skin. And often what we're doing there is recognizing a link between mind and body. Now, there's a lot of clinical observations, by the way, to back up those kind of links between emotion and disease state. We're very familiar with how stress can reduce your immune response over time, because stress is about survival. And when we're in survival mode, we're not focusing so much on longer-term maintenance of health, the so-called ordinary housekeeping as well, factors within the body. It's about fight and flight, getting blood to your limbs, getting oxygen into your body to fight or flight. And so other functions are reduced, like digestion, immune response, and so on. And to reduce the digestion, the body will expel the food. So in a great emergency, a person really almost has no control over that evacuation of the bowel. It's been noted in military settings, in other settings as well. And so we've all experienced these things in everyday life where the mind affects the body to one degree or another. Now, what hypnotherapy takes that ability of the mind and trains it and develops it and uses it more and more for a wide range of conditions. So in a good hypnotherapy course, based around real experience of the trainer who has been in the trenches, who's worked with a lot of medical conditions over the years, In our training course, for example, we do a lot with surgery and medical procedures, helping people cope with the stress of surgery, the anxieties and worries, and maybe sometimes difficult situations within surgery. It's long, protracted, recovery may be difficult, complicated because of age and so on. So we deal with the pre, peri and post-operative aspects of the surgery with programming. With invasive procedures of, let's say, assessment, let's say a colonoscopy, and other treatments or procedures really that are difficult for people to handle, we could use hypnosis there as well. So, but keeping it for irritable bowel for the moment, it's often been said the gut is a second brain. We talk about our gut feelings all the time, don't we? Oh, that gave me a bad feeling in my gut. You know, I wasn't sure what he was saying was true, right? Or I had a gut feeling that that was going to happen. But so we're recognizing that there's powerful neural activity. In fact, many of the neurotransmitters in the gut are similar to those in the brain. And it's a second brain. It has its own almost entirely separate, at one level, almost entirely separate brain activity. The celiac plexus and various ganglia and plexuses in that area that are very important for regulating such as the digestion, also sexual functions, and a range of other functions down in the lower abdomen region and so on. And so we can tap into that natural response, that natural ability of regulation in that area. Now, of course, the brain sends signals to the gut, so those two nervous systems are in interaction, and vice versa. There's a lot of chemical release from different mental states that affects the gut, and we know that the gut, when it's in an unhealthy state, will be dysfunctional in the chemicals it produces, including, and let's just touch on the gut's functions here briefly. We know that the gut is very involved with digestion, the absorption of foods, obviously, the excretion of the waste material, and various body products as well. It's also involved with protection, particularly with immune response. And so the gut has many axes, as they're called. The gut to brain axis, the gut to lung axis, which many people don't think about, gut to kidney, gut to liver, and these are very interactive. And so when there is inflammation in the gut, and irritable bowel is not inflammatory bowel disease, which there's two main kinds, Crohn's disease, ileitis, inflammation of the ileum, and also we have ulcerative colitis. Now those are physical conditions which have some symptoms in common with IBS, but have others which are not, and they're much more serious. And they may be a progression of a very severe irritable bowel state, or they may be more genetic problems, and also they can be caused by, made much worse by viruses, by infections, and so on. But we distinguish those from the IBS, which is seen as primarily a major area of psychological plus physiological. We don't deny the physiological. Some people's guts, their muscle sensitivity, because the gut is one big long muscle, it is more prone to being infected. It's more sensitive, more overacts with certain foods, and yet, as much as that is physical, the mental emotional factors can be used to help it, to calm it down, to relax the gut. And we can give suggestions very specifically to help them with their gut, to improve specific problems within the gut, to make it more calm, slower acting, more stronger in its digestion, better in all of its functions. Now we know that anxiety and depression affects the gut, and the gut can trigger anxiety and depression. And sometimes a bit of a chicken and egg to say where it comes from. And we want the gut to be healthy. We can give suggestions for the wonderful healthy bacteria it produces, which are so important for our well-being, so interactive with the chemical production, the neurotransmitter, the transmitters that are produced, and all of that wonderful immune function that it's very involved with. So there are, I'm not going to go into the technical side of that here, it's quite complicated, the kinds of transmitters produced in the gut. But when the brain is anxious, we can get abnormal contractions of the abdominal muscle. Also of abdominal blood flow, arteries pinching up, narrowing with stress, so there's less blood flow. That has consequences. It can diminish the effectiveness of cells. We can have a diminishing of the production of acids and enzymes. We can interfere with our gut by interfering with the blood flow. We can have inappropriate hormone secretion, the sympathetic nervous system activity, interfering with all kinds of activity within the gut, including the speed of movement, the motility as it's called. So when the gut becomes then hypersensitive with this unhealthy activity that's all going on in the gut, we're much more unable to handle certain foods. So when we're much more relaxed in the gut, everything is much better with digestion, absorption, excretion. It's much healthier, calmer, and so on. So those symptoms that we see with the gut, with IBS, of bloating, of difficulty with absorption and digestion, the pain that comes with indigestion, and so on, the constipation, and then the other extreme, diarrhea, the feelings of incompleteness, pain in the lower region. There are a lot of symptoms with IBS, but I'm just giving you the main ones there. They're very debilitating. They can cause a lot of anxiety and stress in life, which then feeds back into the problem. The fear of the problem, exacerbating the problem, as we say. So we want the person to help themselves a lot, teach them self-hypnosis, to work on their emotions of anxiety, depression and guilt, which may not all coming from the gut, of course, might be anxious about their relationships, they may have lack of self-love from childhood experience, may be quite depressed, have a lot of guilt and shame. Guilt is a very powerful inhibitor of activity in the stomach. That's been discovered over decades by doctors, seeing the correlation between people high levels of certain emotional problems which trigger the gut. And so our brains often misunderstand our symptoms. For example, a person says, oh, there must be something wrong with my gut, and looking to the doctor then for medicine, which may be helpful and may be very important. And obviously we only work with people when they've had a full medical workup, medical opinions at least on the subject, on the gut. But the brain may be misinterpreting what's going on, and so instead of trying to force the gut to be healthy through medication and so on, what the brain needs to be doing is sending the relaxation messages for the gut itself, the messages about being free of guilt and shame, being less anxious in life, more positive, more confident about themselves, so on. And in that case then, it's win-win. The mind is affecting the gut better, the gut affects the mind better. In some cases, those negative messages in their psyche that are to do with fear and doubt and not feeling confident and positive about themselves in life, that may require deeper hypnotherapy work. And hypnotherapy, through so-called analytical hypnotherapy, which we teach in our courses as well, we teach a particular form of that called transforming therapy, which is based on the work of Gil Boyne, who did marvelous work with medical hypnotherapy, and who built on the work of Dave Ellman and others. Dave Ellman was a famous hypnotherapist. He wasn't a physician, but he trained more physicians than anybody else at the time in medical hypnotherapy. We're the publishers for Ellman and Boyne's work, and we teach that in our classes. And irritable bowel, we teach people to take control of their gut, to be able to relax it, to help its functions in various ways, to be able to go into self-hypnosis very fully and give themselves a lot of help there. And so take control over it. And there are good medical studies now over the last 40 years and more showing the value of hypnotherapy for IBS. And that's even simply for the suggestion and programming style of hypnotherapy, which is one part of hypnotherapy, provided it's done well, thoroughly enough. And that can help up to 70% of people get significant relief. Some even overcome the problem completely, and they're not having to worry so much about their diet, although it makes sense that they have proper professional assessment about diet so that they know there may be things in there that are not helping them. There are genuinely people with allergic or severe intolerances, at least certain foods. You can have celiac disease, you can have other problems which impact greatly on the gut. But it's amazing how in many cases, and you mentioned it yourself, when the gut begins to calm and get into a healthier level of activity, they can often handle foods in a healthy way that would have been difficult before. So there's so many areas and ways in which hypnotherapy can help the gut, the gastrointestinal system, which is so vital for life and for health and well-being, with so many parts, so many functions, and so many factors that affects it, from genes to foods to stress to deep emotional issues and challenges and problems in lifestyle in our lives. And we need to look after our gut and really help it. And hypnotherapy is the method par excellence for helping the human gastrointestinal system.
I totally agree with that. It's as you know, it's been really life transforming for me, and I really recommend to anyone who is interested in the mind, in uplifting themselves, and also have issues, if it's physical pain or fatigue or IBS, to try get in touch with Dr. Butler or go on one of his courses. I've done them myself. I work with Dr. John Butler from time to time. We have some projects as well. So I can recommend him from inside. I've been both a student that didn't know him and also as a person that had the honor to work with him on certain things. And you are more than words can describe. And I will leave in the description below links directly to Dr. Butler and his school, and so you can read more about that. And I always feel I can ask you more questions and go deeper into things, but I think this has been really helpful. I would like to have you back again in future on at least 2 more topics. One topic is sleep. As you know, Dr. Butler, a lot of people with ME, chronic fatigue syndrome like myself, and fibromyalgia, either we struggle to fall asleep and sleep at all, which was in my case, and you taught me some things which enabled me. I'll just tell you that I once went on a trip to Thailand after I'd done a course with Dr. Butler. I slept for, I think, 10 or 11 hours out of the 12-hour flight. I never sleep more than 1 to 3 hours usually. And once I've learned how to switch off with him, it was my partner and my friend that came with me, they were amazed. They couldn't sleep and they have no condition. So that's how powerful when you know to master getting into a trance and sleep state. So I would love to have you on a sleep in future. And another thing is about anxiety. In recent years, I have developed anxiety, and I've done analytical work with you and regression, something that a lot of people are finding interesting. And it is such a powerful thing to go back to your childhood and deal with things that as a kid maybe you couldn't have dealt with, even if they're not so big. But in the child mind, maybe they are big, and learning to just make peace with them, as you taught me in our regression work. It's I think every person owe it to themselves. It's such a special experience to learn to do it. So if you go on the course, you learn to do it with yourself, which is very beneficial. And also if you manage to get a slot with Dr. Butler, and do it with him as well, it's really a unique experience. And I just found so much more peace and confidence. And since I've done the regression work with you, Dr. Butler, as you know, I've published a book with Penguin Random House. I'm working on a podcast, as you guys know here. My vegan cafe business progressed and was number 6 cafe at one point, and I really link all of that burst of growth and positive energy and capabilities to the work on class I done with you and on one-on-one. So there will be at least two more episodes that I would like to have you on. So thank you so much for everyone who tuned in, and I'm so excited to have Dr. Butler again to talk to us again. And as I said, leave the links in the description below. If you have questions to Dr. Butler, leave a comment. If it's on YouTube, then obviously in the comments, but if not, I'll leave as well social media for both me and Dr. Butler, so you can ask us questions on what you'd like to hear from him more, because he's always so keen on helping, and he's really dedicated. Is that over 40 years you've been working now in the field, Dr. Butler?
Well, this year, 42 years doing professionally, and then there were years before that where I did a lot of work with people in their minds, suggestion, meditational kind of practices, which is very similar to self-hypnosis. In fact, some of them were very much self-hypnosis. And so there's a lot of years involved in it and a lot of experience during those years. So I'm often, I'm very happy to share any knowledge that I've acquired and the skills over the years. So thank you, Aidan, and thanks to everybody who's listening in.
Thank you so much. I'm looking forward to reconnect with you in the near future.